positions, we're walking, we're running, these knee joints really can use some tender loving care. So if you have a knee condition or a knee problem, here's something that's extremely effective and safe, which I'll explain. And if you have no symptoms, I want you to challenge yourself by doing what I'm going to show you. Before and after, you're going to feel an amazing difference. Just because you don't have pain in your knees doesn't mean it's functioning 100%. It may be working 90%, 80%, but what we're going to do, very simple, is to restore movement in the kneecap. So I'm going to use my knee. I'm going to talk a little bit about the knee. And here's something you're really going to love. It's something where I spent a lot of time working with extremities, with major athletes over the years, and there's a lot of stuff we can learn about biomechanics. And the knee is basically just a simple hinge joint. And if the knee joint is not moving correctly, we can develop other conditions. So just a quick review. The kneecap is a free-floating bone, and it sits over the bottom part of the femur. And when we walk, it goes up and down. There's a track behind it. So I'm using this table so I can have a front view of you, and I could just show you a little bit on an angle what I'm going to do and what you can do along with me that may make a tremendous difference. Now, inside the knee, we have discs, we have the meniscus, the medial meniscus, the lateral meniscus on the outside. The function of that patella, that free-floating bone, is to protect the knee joint, as well as for the quadriceps, the muscles that when we contract our thighs, just getting up, we're using these muscles, they attach on top of the knee. So when we bend the knee cap has to move and glide. But here's the problem. If our muscles from the inside of our knee to the front of our knee to the outside of our thigh, from all these muscles that encompass the knee joint, if they're imbalanced, it will throw the alignment off of the patella, which is our kneecap. And that patella is supposed to move up and down on a particular groove. So if you take your fingers, we'll use our thumbs, you keep your leg straight and move it up and down like this, it should glide real easy. But it should also glide if you go side to side. See, right now it's not gliding good going this way, okay, but it's good up and down. It goes good inside, and it should go in this angle and this angle. The kneecap should be moving 8 different directions. So it's going good to the bottom right on that angle. This side, not so good, because moving outside on my kneecap is not moving really good. So this is my main issue, is going this way and this way. But this is what we're going to do. We're going to just put movement into the kneecap, because many millions of people who have knee issues, it may be referred from the kneecap. And if we can just put movement in the kneecap to restore motion and let that function, the proper biomechanics work in that kneecap, then other muscles as well as other parts of the joint can start to work naturally again. So remember that every time we have a knee issue, or any issue that is in the body, there's always a primary cause. If the primary cause is not functioning right, if it's locked up, if it's not moving, then other joints, other muscles have to compensate, and that's when we start developing more problems. Because whenever we're dealing with an injury or a chronic condition or a chronic problem, even if you have no pain, there's always a primary cause. So what we're going to do is that I'm going to take the kneecap, and we're just going to challenge it, because as I push in, we're going to give little impulses going down just to make sure it's moving. Okay? Now you want to make sure the leg is straight. The leg is straight where the muscles are completely relaxed. I'm going to pull the kneecap up with me. It's a little impulse like this. Then I'm going to go to the inner diagonal part this way. It's already moving all right. I'm going to come this way on me. It's a little locked up, a little bit. There it goes. And you will feel a little impulse. You can hear a little noise. You may hear a little movement. Our objective for me to teach you is not to adjust joints or bones, but just to free up movement by putting little impulses in there. So when you do this, don't force it, just go gentle. As I come out this way, just a little impulse, and I'm going to come to this angle, and I'm going to come back in this angle. Okay, just kind of grab around it, little impulse. Now, this should never hurt you. Now, when I went in one direction, I heard a little crepitus, I felt a little movement in there, and that area was obviously fixated or not moving correctly. Now, what you'll notice when you start freeing the kneecap up, because you'll notice before, one area or two areas or three areas, as we go up and down, side to side, angle, inside angle, diagonal, and both diagonals, you may notice a few areas when you start moving it around initially, it's not moving correctly. It's just locked, it's not moving. So when you take a little impulse to the area that's not moving, and you just get a little impulse, that frees up that motion. And by freeing up that motion, it frees up the function. And I can tell you many stories, but the last story I can tell you, which is quite amazing, a neurologist friend was ready for surgery because he had all this knee pain. He came into me and I checked his motion of his kneecap, didn't even look in the knee, and there were two areas that were locked up, and we just put a little motion in the knee, and to this day, he is perfectly normal. So it shows us that regardless of what condition we have, it may be our disc, and we see, hey, we have a herniated disc in our lower back, a bulging disc. It may not coming from the disc, it may be coming from the sacroiliac, from imbalance of the muscles. But for the knee purpose, what we want to do first is that you're going to put it through different movements, see what area is not moving as we go all the 8 directions, up and down, lateral, medial, diagonal this way, diagonal this way. You may notice, hey, it's not moving that position. So all you basically do is you're going to take the kneecap, push it to tension, and a little impulse. That's it, little impulse. It shouldn't hurt, but many of you may feel a little pop or a click because it's been locked. And the beautiful thing about the human body is that when a joint is fixated or not moving correctly, and then you apply movement to it, and you restore that movement, guess what? It's yours. It's all yours. So what I'm saying here is that you or anyone can be having fixations, loss of movement in a joint, particularly the knee joint, for years and years and years. And it may be as a result of maybe one hip's been higher, maybe from an old fall, from an injury, maybe the way you're walking, maybe you're obese, maybe you're in an awkward position, the way you work, maybe you're bent as a mechanic. But you want to go ahead and check both knee joints. I will tell you, you can be the happiest person in the world. You're going to say, wow, I feel all that tingling in there, everything freed up. You may notice that the knee pain you were having just dissipates, goes away. You may notice the clicking you were having or the problem before just dissipates. You may notice that the meniscus problem that you have doesn't hurt anymore. It's a wonderful thing. So I really hope that you will take this, value it, treasure it, use it, play with it. Remember, it's all about taking the tension out, a little impulse. Taking the tension out, little impulse. Taking the tension out, little impulse. Just restoring movement. It's not about me teaching you adjustments. It's about restoring movement, restoring function, restoring health, restoring happiness, so you can feel pain-free. I hope you enjoyed this video. Please take the time. And even if you have no pain, just check your joints, check the kneecap, and you're going to say, wow, I never knew it wasn't moving like that. And put that little movement in there, a little impulse in there. You're going to say, wow, get that little tingling, the hyperemia, that blood supply feels good. It frees up, it feels lighter, and you start to get up and walk, and you've got things feel so much different. Do both kneecaps. Check them out. Share it with someone that can benefit. I wish you good health. Make it a great